Mr. Chair, would you like to move your bill?
Yes, Madam Chair. So I'll move House File 3732 to bring that before the committee. And then what I'm thinking, Madam Chair, is that I'll move the DE1 amendment, and then we can discuss that. The two amendments really are separate proposals, separate ideas. And so I'm thinking maybe we'll do the DE1, have a discussion about that, and then can move to the A1, if that's okay. So I would move both House File 3732 and then the DE1 amendment and seek to have a vote on the DE1 amendment.
Thank you, Mr. Chair. Would you like to explain the amendment?
Yes, and I suppose it occurs to me we can't have a vote without, we'll need to have that, the A1 amendment anyway. So the DE1 amendment, members, comes out of something that I noticed, which is that a number of the proposals that we get as a committee relate to the healthcare workforce. In general, we are investing workforce development funds on ensuring that people with barriers to employment receive support in getting access to employment. That's a good thing for all of us when that happens. The Pathways to Prosperity program and others assist adults with barriers. Youth at Work and other programs are assisting young people. That's incredibly important. There's another category, which is addressing where there are shortages in particular sectors of the workforce. I think my Republican colleagues would agree based on their comments earlier that in general, we can rely on the market to address when there are workforce shortages in many areas. That what happens is that folks get the training they need themselves. Employers perhaps raise wages, various aspects. Healthcare seems to be an exception to that in some areas where we've had proposals from Representative Lesnikar, for example, to have CNAs be trained. We know there was the bill from Chair Baker jumping off from a prior year to train rural oncologists. So there are a number of examples of this. And so, members, my thought was to have a workforce grant program as listed in the DE1, to have it be that DEED can identify areas where there are particular needs in the healthcare area and make sure that we're meeting those shortages. And I'll note that my thinking is that then that as we would fund, you'll notice that there's no dollars going to this year. This would simply be establishing the program. And then if we choose to use it, we could then allocate particular funds to particular aspects of the healthcare workforce that we may have concerns about in any given year, such as CNAs or rural oncologists or other people working in healthcare. So that is the point of the proposal. And Madam Chair, if it makes sense to just discuss it, because we wouldn't be able to vote on the DE1 without the A1 anyway. But
Thank you, Mr. Chair. So just so I'm clear, the plan will be to then have you discuss the A1, adopt the A1 as an amendment to the amendment, and then adopt both.
Correct.
Okay.
And then the delay over 3732, of course, yeah. And I just don't know the best way to have that. I almost wonder if having I'm not sure the best way to do that. I suppose we could adopt all of them and then have a discussion about each one in turn. Maybe that is easier.
Let's do that,
Yeah, sure.
Mr. Chair.
Yep.
So so the A1 is the amendment to the amendment. All in favor of the A1, say aye. Aye. All opposed? Okay, the A1 is adopted, and then, or the A1 to the DE1. The DE1, all in favor of the DE1, say aye. Aye. Opposed? Okay, great. So before us is now 4598 as amended.
Actually, 3732.
Yeah. Sorry, 3732 as amended. Mr. Chair, to your bill, as amended.
Thank you, Madam Chair. And so, members, I described what's in the DE1, which is this healthcare workforce grant program. And we can, I suppose, maybe I will, maybe I'll change what I was going to do before and just describe the A1 as well then with a separate idea, which is, you'll see it's an Office of Community Investment with Indeed. I've worked extensively in the public safety space, as folks know, as a prosecutor outside the legislature, and have worked with the Office of Justice Programs, the Department of Public Safety. That's an office that provides strategic grant management for that agency to ensure that not only are grant processes followed well in terms of vetting, et cetera, that's very important, of course, but also that there's a substantive goal achieved in the grants that are brought forward by that agency in partnership with the legislature. In particular, I had an experience in my first term when I was in the minority of advancing a grant program to fund state investigations of sex trafficking, collaborative multi-jurisdictional investigations. That was something that I noticed was a gap. Introduced that bill with pretty general language, and that statutory language ended up being adopted, or that legal language, that has stayed the same for many years since, but OJP has changed over time how that how those funds have flowed as they've developed expertise in how to best allocate those resources. So that's a model that I think works really well. Throughout the session, as I've talked to folks, I've had a number of people say to me, and I felt as well, that we really could use an OJP with Indeed, and this idea would establish that in this form of an Office of Community Investment. You'll see in this short paragraph the responsibilities of that office. I would anticipate that existing staff, to a certain extent, would be moved over, that there'd be, of course, relationships and work with agency staff throughout, and there'd be some funding to hire a couple of additional people as well to fill out the office. So those are two separate proposals, both being considered together today, and I know there's one testifier that there'll be for at least one aspect of this, and then open to a discussion. Thanks.
Thank you, Mr. Chair. If there is a testifier to the bill, come up and state your name for the record. Welcome.
Good morning, Vice Chair. Good morning, Chair and members of the committee. My name is Mainza Thaw, spelled Mayer, but pronounced Mainza, President and CEO of the Hmong American Partnership, or HAP for short. Thank you for the opportunity to testify today in support of establishing a healthcare workforce grant program, and thank you to Chairs Pinto and Baker for your work on this amendment to this bill. This program is timely and necessary. It recognizes a fundamental truth. Workforce shortages in healthcare will not be solved by market forces alone. They require intentional strategic investment. At HAP, we are already doing this work, and the results are clear. In 2025 alone, through our CNA, which is our nursing career pathway, and phlebotomy pathways, we graduated over 300 students, supported nearly 260 industry-recognized certifications, and helped participants move into employment at an average wage of $23.50 an hour. At the same time, 45 individuals continued on to higher education, strengthening long-term career pathways. But the demand far exceeds our capacity. Today, we have over 130 individuals waiting to enter these programs, individuals ready to work, to train, and ready to fill critical workforce gaps in our healthcare system. The challenge is not interest, the challenge is access. And so without flexible funding and programs like this, we are forced to limit enrollment, reduce cohort sizes, and delay entry into the workforce, even though these are already 6 to 8 week training programs that can quickly move people into jobs. And so this is really about filling urgent workforce shortages in our state, strengthening Minnesota's healthcare systems, and creating real pathways to economic mobility. I urge your support on this amendment. Thank you.
Thank you. With that, I will open it up for discussion. Representative Zalesnikar.
Thank you, Chair, and thank you for the presentation. My question, I support this. I just want to probably make more of a comment that the bills that went into, that I drafted, came from the community. One was in Two Harbors. We had an ambulance issue after being on the task force for ambulance services. And in greater Minnesota, I think it's really important that this grant process realizes distance to travel. So we've had pathways and opportunities for students, but when you have to drive an hour or you have to drive 2 hours from greater Minnesota to access it, wherever it's being held, that is a barrier to entry. And I can see that because the results are showing for itself. When you train locally at like the CNA programs at the hospital, and it's a very innovative model where they're getting hands-on experience right with the staff at the hospital. And in the EMT program, they were able to do ride-alongs right with the actual ambulance staff in Two Harbors is training people that actually have the jobs. And so these students are actually being able to take their EMT license when they graduate, and the tuition's covered. But when I talk to the students and I talk to the community members, the enrollment has been maxed out in both programs, and the ambulances are going to be staffed up the North Shore. So when you're traveling up north, you're going to have a little bit of peace of mind that we'll have coverage, because it's been a huge issue. And so I just urge the department to really remember where they're going to locate training. It has to be where there's pockets of gaps that match what I was saying previously, that where the training is, we go to the community when we have the possibility. Because it's not possible for all the students in high school. I was a nursing assistant at 16, but it's very often that you have to drive an hour to access education, and that's just not feasible for people when we have winter driving 6 months of the year, long distances to go, and not everybody has a vehicle or has the ability to do that. And this is worked, so we have to make sure we don't lose that in this program would be my ask. Thank you.
And Madam Chair, may
Mr. Chair.
Thank you. Yeah, so Representative Zalesnikar, I take to heart all of that, and I'd say we want to make sure that as the agency is making grants, that they're doing so in ways that that meet community needs, that really are effective. I will say one challenge in our committee I felt, and I think Chair Baker has agreed with this as well, is that when you make all these individual appropriations to individual agencies, it's actually hard for us then to hold the agency accountable. Like what I'd rather do is have us say, these are our policy goals, these are the parameters. One of the parameters should be how easy is it for people in the community to take advantage of the given service, whatever it is. But we set out a series of goals, we decide the amount of money. That's complicated enough to do that, but then we can hold the agency accountable. So if they're not, for example, meeting your community's needs, that's something that we can then oversee. But I think it's hard for us to do that. We're spending so much time on each individual appropriation, and that's not something that I see in other committees. And I'd like to have that be a shift in this budget area to have that work more effectively. So I really appreciate what you say.
Thank you, and I just a comment on that too, because I think Representative Zalesnikar, I think the point you make both about the substance, but also about the process, actually speaks to the second part of the bill, the Office of Community Investment. The idea that we would want a program like OJP, but indeed who's working both with community, but also with legislators, and ensuring that our priority setting and input is actually part of how those decisions are made, that we are incorporating that. I think on this committee, have often been frustrated that it feels like the agency and their proposals feels disconnected from some of the conversations we're having. And that has been, since I've been here. I think the idea of having an office where one of the things that this committee and this legislature is doing is working together to set those priorities and also bring in the things like I've heard Representative Hussein, I've heard Representative Kozlowski, I've heard you, Representative Zalesnikar, talk about some of the unique experiences in whatever the region is or whatever the community is. We have value to add, and I think having an office like this that can really do some of that process work will be really, really important in this, as I see in the language, strategic direction for grant making, in the idea of setting specific goals with documentable outcomes and allow us sort of a better vehicle to hold accountable to those goals. So I appreciate both that for both pieces of this bill. Representative Hussein.
Thank you, Madam Chair, and you're right, everything that you have stated. Chair Pinto, thank you for bringing this forward. This is a very important step forward for our state. Because Minnesota is facing a serious workforce shortage in healthcare. This will help us strengthen our workforce and ensure Minnesota have access to care that they need. This office will provide more, because I have many family members that work in healthcare and they are overworked. And we need to step up to give more trainings. I want to thank for testimony, and I know how great work that you do for our district and our community, because you do train a lot of students who are landing good paid jobs, and that's what we need. That's the only way we can get out of the poverty. We want to make sure that people landed at good jobs that pays and take care for their family members. And I am 100% supporting this bill, and thanks for bringing it forward, and thanks for thinking about this.
Thank you, Chair.
Appreciate it.
Thank you.
Oh, any further discussion of the bill? Before you go, Representative Baker, what I am really grateful for, and I think that both Chair Baker and Chair Pinto have been working on, is how do we do this system or do this process better more in line with sort of a strategic angle, more in line with the priorities of the legislature. And I see this as a piece of that. I know that we're going to hear, Bill, tomorrow as well about how we make this transition. And so just really appreciate all the work that's gone in. Looking forward to more work as this moves forward. Representative Schultz, you want to go before Representative Baker? Go ahead, Representative Schultz.
Thank you, Madam Chair. My quick question would just be, if this didn't happen this year, how would it set us back to these goals that we've discussed around this table?
Chair Pinto.
Thank you. Thank you, Madam Chair. Thanks, Representative Schultz. Taking each one in turn, getting a good idea in place earlier rather than later just means that if it's a good idea, then if it goes in later, you're missing the chance to have it happen. I guess if I go to the Office of Community Investment, it's going to take a while, presumably, for that office to get up and running and provide the kind of strategic partnership with us that we're looking for. So if we wait till next year, then it means that by the time that office is up and running, presumably it's another year and a half later, next year we'll be appropriating funds for grants in some form, presumably, and then we're going to be sort of lacking the benefit of that connection. And what I'd like to do is have the office be in place so that when we make those decisions next year, by the time you hit summer of 2027, we've got an office in place. Again, if it's a good idea to pursue, we would want it to be in place to then take advantage of that next budget cycle. Because again, we just wouldn't be able to if this passed at the same time as those grants, at least without really slowing things down. And we know that one of the concerns that's expressed, I think quite legitimately, is if it takes a super long time for the funds to get out the door in the first place, then they're not being used in the way that we'd want them to. I'll note with the Healthcare Workforce Grant Program, a similar point, but even added. When a program is codified, one advantage of that I've realized is that the agency can actually get RFPs out before the budget session starts, even if there's no funding for it, because then we then decide how much to put in, and then the agency, how much funding to put in, and the agency then can prioritize applications and fund, if it's only a little bit of money, it might be just the top couple applications. If it's a lot more funds, then many more of the applications. What that means is the funding can get out the door a lot faster to agencies if we have a codified grant program in place. I'm familiar with this in the homelessness area. The Emergency Services Program is one where that program, they do the RFP the winter before the budget session. So by the time once we make a budget decision in hopefully May, occasionally it's been in June, they're set, they already know who the funds should go to, and it's just a matter of how much money is available. So codifying a grant program has a real advantage in terms of getting the money out the door fast. So that'd be a reason to get this grant program and others as well codified if we possibly can this year.
Representative Schultz, follow up? No. Chair Baker.
Thank you, Madam Chair. And again, I want to thank my co-chair Pinto on this work. I think one of the reasons why I'm excited about the potential of our week ahead of us is to work together in a moment of bipartisanship that we don't know who's going to be running this committee next year. We don't know who will be chairing it. We don't know which party will be in charge. But what we do know today is that I think both Chair Pinto and I recognize the need to make changes when it comes to competitive bids, competitive grants, direct appropriations. And I think what we have learned firsthand, being our first-time chairs in this committee, is that we can do things better. And I think by our many hours of sitting down talking about why do we do it this way, and why do we, how can we change it? I'm not a fan of expanding offices of something, and that's the problem that I've shared openly with my co-chair. Mm-hmm. But I think in this case we are going to get a great return on investment because what we're doing currently isn't maximizing our workforce deserts out there like Rep. Zalesnikar has talked about. Those are real, and I think we're likely always going to have direct appropriations for certain things, but I think we can do a lot more around competitive grants. This office will help us with those investments in a way that I think we may not have that opportunity to do the same kind of work next year because we don't know who's going to be sitting in our chairs. So I think to just, again, give credit to the procedure that we've come to over the last 2 years of our work here, I think this is a beginning of relooking at our grant reform programs that I have brought forward and relooking at what Chair Pinto has brought forward here. I think we are going to find a way to do our work better because we'll have better guardrails, more oversight in not breaking the bank kind of a thing. This is the way we should be doing this in a way that I think moves along to the next legislative session. So I hope that we can support this. I certainly plan to do it, and I appreciate your work on this, Co-Chair.
Thank you, Mr. Chair.
Thank you, Madam Chair.
Chair Pinto.
All right. Yeah.
Closing comments.
Yeah, thank you. Thanks so much. I really appreciated the testimony around the Healthcare Workforce Grant Program, and I think I sense from all members that there's such a need in that area. I just want to make a comment a little bit more on the Office of Community Investment. I mentioned that grant program I established as a first termer relating to investigating sex trafficking. To your point, Madam Chair, about collaborating with the legislature, after that passed, OJP reached out to me. We had a meeting about sort of what was intended, and as they were shaping the program, they then came back in the following years as they were recognizing this is working well. We think this would work better, and they've educated themselves through the years about that issue and many others to then be able to shape it and recognize what are best practices in that particular area. I would hope we could do something similar in DEED as well, and provide support to support the fabulous work that the Commissioner and the agencies are already doing. So, members, these will come back in a couple days, but I so much appreciate the conversation now. Thank you so much.
And with that, I think it's laid over.